We should all be seeing that screen as it is on top, with no other distractions on the screen. All good? Excellent. Okay, well, morning all. So this morning we're going to be, as I said, when we closed out on the last session, we're going to be starting to move into a closeout session where we're going to be looking at more practical tools needed to shift the mindset, more dynamic approaches, and different ways of how we can start to restructure our thinking, restructure what's happening around us, and also have a couple of reflective moments when we look at how we are positioned within any of our services or wherever we work in with the people who are working around us, and if we are in a management position, how we are running our teams and how we're caring for our teams. Just once again, starting off with a personal, medical, and disclaimer that these views are my views only and are not affiliated to any organization aligned to this presentation, Coffee and Cases, or its affiliates. And also that during the course of this presentation, if you feel that as you're reflecting back, that it brings back memories and flashbacks to you and affecting you, then I would encourage you to reach out to your own providers who can look after your healthcare providers, and where you can discuss these things in a safe space, wherever that would be. I heard somebody saying my voice was a bit soft. Is that a little bit better now? Is it a bit clearer? The gentleman who posted that. Take that to mean a yes, I hope. Right, so as per our last session, we closed out that we were where we were and we were looking at where we're going next. So during the course of this session and towards the end of it, there will be a lot of resources and reading material in the last slide of this presentation. And we already know some of the opportunities for support platforms, the Mentors group, which is part of Coffee and Cases. Life and health coaching, we'll be discussing further on down the line. I'd also would encourage you to log on to the Epic YouTube channel. The presentations are loaded there. The previous presentation was loaded, is up on the channel. The Mentors presentation is up on the channel. The first presentation I did in terms of my journey isn't on the channel, and then I'm sure that this presentation will be loaded as well, where a lot of the references and the books which I've been using for this presentation and just generally within my own journey are part of a bibliography at the end of this. So I would encourage you to, and also leave comments on the YouTube channel if you want to reach out for further discussions or chats as well. So that said, in terms of today's agenda, as I said, we're going to be looking at multiple support tools, frameworks, and avenues to work around both formal and informal of how we can start to rethink, relook, and repack where we are from a mental health space, from a physical health space, and an emotional health space. Just to recap again of the key area that we have been focusing on the last session, and we'll be spending quite a bit of time having a look at on this session, and that is the bucket of resilience. How to keep that bucket full, how to focus on nurturing a positive view of ourselves, how to look at we can move towards the goals that we've been chatting about. And then also start to look at what sort of change we need to be putting in place in our own lives, in the lives of our teams, in the lives of our company, or even within our family space and home space. So that's what we're going to be looking at, and standing a bit deeper and deeper into how we're going to be moving forward, sinking ourselves into this process of actually starting to be positive, be creative, and start really understanding where we are as individuals and as practitioners, and how we want to do that. And as the poem on the right-hand side says, in the waxing and waning of life, as the sea of tranquility transforms, with the fast approaching misfortunes of Poseidon, be that island of serenity in the raging storms, and pounding waves of life's tempest. Just stand serenely and be. Hopefully, as we've had time to reflect over the last couple of presentations and today's presentation and moving forward, we will all be in a place, a far more calmer place, a far more gentler place, and a far more compassionate place towards ourselves. And if that's what we can take away from this process, I think we've already started to make an impact on our own individual space, because only once we've made an impact on our own individual space can we make an impact on other people's space around us and on our patients' lives. So a key element of what we need to look at is psychological resilience. So psychological resilience is a learned trait. It's the ability to adapt well in the face of adversity. And it's not a fixed dynamic. It's a learned, organic, growing process. It involves coping mechanisms, finding ways to bounce back and thrive despite all the challenges around us. So it's really how we can process the event that's happening to us in our life. And if we look back at our life story to now, how there'll be historical events that we would be wanting to rethink and relook at, which might be dragging us back. So for us, it would be looking back at those experiences, finding ways to navigate around them and how we can bounce back from them so that they don't keep us dragging back into dark spaces. And that's really what we're looking at. Interventions that foster resilience, to look at how we can put together a resilience framework around our own space of where we are at this moment in time. Then if we look at, as I said, resilience is a learned process. So if we look at the little diagram on the right-hand side, we look at the 4 key areas, which will be our physical health, our mental health, our emotional health, and then our social network of our support group, our connections around us. So that's what we would be looking at. Somebody's got their mic on. If they might just want to switch it off, please, I'd appreciate it. So that's what we're looking at. So we're saying the physical resilience is the body's capacity to respond to stresses. So if we want our body to be able to manage the stresses that are around us, then what we need to do is we need to work on our own physical well-being, on our own strength, our own stamina, that's our physical health, in terms of, as we've spoken about, whether it's going for a walk in the mountains or whether it's going for a walk in the garden or walking your dog or going to gym or CrossFit or hitting a punch bag. And then looking at our mental resilience, the ability to maintain or regain cognitive capacities. Because as we do know that when we are in times of stress, both during the moment and post the moment, we do go through cognitive dips, which then would affect areas of our life where we would normally be excelling in. So some of us might be very creative in our off time or very active in our off time. And due to our mental fatigue, we're not able to be creative or active or supportive. So we need to work on how we're going to manage that mental resilience. Our emotional resilience is sometimes the one that most of us tend to avoid talking about. And this comes back to us understanding, appreciating, and regulating our own emotions. Not, when I say regulate, I don't mean blocking emotions, but learning how to manage them, so that we can consciously think through feelings and responses rather than just simply reacting in the environment and reacting in the moment. But as we said in the last session, take that moment to pause, take that moment to breathe, take that moment to reflect and think about where we are and what we're going to be doing before we say it. I'm about the first person here who should be taking that feeling to heart, because I do sometimes react without necessarily thinking of what I'm saying. And so those are the challenges that we would need to focus. So it's a lot of self-work, a lot of self-reflection. And then our social resilience reflects on our capacity to work with others, to assist others and endure with others, and then also help others to recover from their stress, and more importantly, allow other people to help us with our stresses. And from an employer-employee perspective, employers should be, and companies should be encouraged to find ways to engage with the mental health of the employees. And providing training in resilience is one way to respond to this dynamic, setting frameworks in place. And this, what we're doing now, is part of this process, where we actually start to actively engage and think through how we can set up successful resilience training in the workplace, and how we can, what sort of models would work and what wouldn't work. We don't have time to dive into all of those dynamics now, but those are things for people in management who are in on the session to reflect back and think about how we can go about working with our staff to give them the tools and aid them to be more resilient, help them to be more self-aware, give them coping skills. And also very important, an important part of this whole process is that we need to start having a positive, optimistic worldview of ourselves and our space. And that's sometimes the most difficult thing for us to do, for ourselves to be positive and optimistic about where we are and where we're moving in our journey. Because so often we're stuck in the rut and we can't see over the edge of the rut. But that's where resilience training, that's where support groups, that's where employee practitioner programs can come into play to help the employees to be more proactive, to be more understanding of where they are and how to work and navigate around that. Excuse me. One of the books that and some of you might or might not recognize the title of this book on the right-hand side there, When Breath Becomes Air. It's an incredibly powerful book, written by the gentleman who wrote it, Paul, who was 37 years old, highly respected neurosurgeon, and he got a fairly shocking diagnosis at the age of 36, that he was diagnosed with inoperable lung cancer. He was given a year to live. And that comment underneath the book, the title of the book, is one of the things that he goes through. So what do you do when life is catastrophically interrupted? What do you do? How do you manage your life? Now, most of us are not in Paul's position. We might know people who are in that position, and I don't wish any of us on this presentation being in Paul's position. But we in the field that we're working, we're interacting with the sick, ill, and injured on a daily basis, and we are encountering people who are Paul. And he, in this book that he wrote this book in the last year of his life. He died at the age of 37, and he made a lot of radical changes in his life in a short space of time, because he needed to reframe where he was. He needed to reframe what the future was, and he needed to reframe what he actually wanted to do and how he wanted to be positive in this process. So there was a powerful, it's an incredibly powerful book to read, and it's an incredibly optimistic book, even though we know I've given you the spoiler alert at the end of the story already, but we know that he, in his process, he shares his life story about how he reframes everything that he thought that he knew. He had to rethink his whole life plan, and how he went through this process of, as I said, reframing, using the power of positive emotions. Obviously, he wasn't able to actively engage in all these areas of a resilient life, but he was able to work through a fair number of them within his process. And I see that somebody has read the book already. And yeah, I challenge anybody to read that book. And I guarantee you, every single person who reads the book, at the end of the book, you'll be in tears. But it is a powerful book to read. So, but the takeaway for you out of this, just this one little snapshot of it is, so what do you do when your life is interrupted? So, and that's something to think about. So when your life is interrupted, whatever might be interrupting it, how do you react to that interruption? How do you reframe the narrative? And how do you take control of the narrative in that interrupted space that you are? Right, so as I was saying, between the stimulus and the response, and as we were saying earlier today, and we've said in the past, is that between that space where your response is being waited for as a result of a stimulus input, in that space of that moment, that silence, that's where our power lies, and how we choose to respond at that point in time lies both our growth and our freedom. The positive growth and freedom, or the lack thereof, depending on how we respond in that moment. So really, and what Viktor Frankl emphasizes is the importance of striving for a meaningful goal, rather than just seeking a tensionless state of happiness or comfort. But so looking at meaningful goals and thinking through those moments of when we have meaningful goals, and looking at how we respond in that moment will define how we move forward from there. And so through the things we do, through the things we feel, and through the stances that we take towards situations, those will be what defines us. And that will define our meaning and our space and our place. So it's also an incredibly powerful book to read, and it's not a long read either. It's a fairly short read of about 150, 120 pages, but it's the most amazing book to read. So, and he builds his premise around how to cultivate hope in uncertain times. Another excellent author that says, hope locates itself in the premises that we don't know what will happen. And in that spaciousness of uncertainty, that's our time, our room to act. So Frankl's assertion and his methodology is to put practical strategies in place to build resilience and find strength to overcome the challenges that are placed on us. Okay. So this process is not contingent on external events, but it's on our own internal resolve and perspective. Our internal resolve and perspective of how where the space we want to navigate to. So hope requires a desire for a specific outcome. And it rejects any other possibilities other than the specific outcome we want, because that belief that we have in that moment is the eventual realization of that hope in that moment as well. So these are profound comments for us to sit and think about, and I would encourage you to take time to reflect on what I've said, and not just let the words wash over you now, but let them go back to them again and reflect and soak on those thoughts. Because when we get into that, that is actually quite profound, because it gives us the ability to change our mindset. So most of us might operate around a fixed mindset, but what we need to do is to navigate to a growth mindset. And we can cultivate it. We can learn to have a positive growth mindset. And the more you lean into a growth mindset, the more receptive you become as an individual to receive considered and constructive feedback. And that's the important part about this, to receive considered and constructive feedback. And that's why at times moving into a growth mindset and wanting constructive and considered feedback in a receptive, caring environment, that is also why moving into a space, a mentor space, a coaching space, a therapy space is a good space to be in to start that process. And if we are sitting behind the desk as a manager or a business owner or shift leader or team leader, and we have somebody coming to us, and we've been thinking about a growth mindset. The growth mindset for us as somebody who's in a position of authority over others is to be receptive to their needs and to give considered and constructive feedback to their needs, not necessarily our needs, or not necessarily at that moment the company's needs, but their needs, because that is more important. So if we look at the difference between a fixed and a growth mindset, and it comes out of the work by Carol Dweck, and she wrote a whole book, The New Psychology of Success. It's a very hefty book. It's not light nighttime reading, but she unpacks this in far more detail and far more depth. So if you have a bent about wanting to get a handle on that, then that book is also listed in the bibliography at the end of this at this presentation. So embracing challenges, embracing change, persisting in the face of setbacks when we encounter obstacles, and see negative feedback as an opportunity to learn, which is sometimes a difficult thing to do. And then find ideas and inspiration from the success of others. And that's partly what we're doing here. We're leaning on the shoulders of others. And as we said in our last one of our previous presentations, particularly the mentors presentation, we're able to stand where we are and move forward from where we are because we have the strength of others around us who have walked the road before us or who are walking the road with us. And that's partly what our journey should be. This is not a solo journey. This is a journey where we need support and the guidance and the growth with others around us. So then that brings us into what do we mean by coaching, mentoring, therapy, etc. So, and that can be where you as an individual reach out to somebody who's involved in life coaching, health coaching, fitness coaching, and working with them in a reflective space where we have the opportunity to shift our identity into a new space, reconnecting with what's innately wise, calm, and creative within us. So with reconnecting with you, with yourself in this time. And the whole process of coaching and mentoring is about helping people reconnect with that inner state that wants to change, that thrives to change and wants to emerge. Really, it's just helping the butterfly get out of the cocoon, because all of us are butterflies and all of us have beauty and all of us are beautiful people, but we just need to be allowed to be given the space, the comfortable space, the safe space to thrive. And if you also, those of us, if we're invested in emergency medicine as we are, we're all about evidence-based medicine and evidence-based practice. And there's a lot of evidence-based medicine and evidence-based practice in coaching, mentoring, and in life and health coaching. It's vested heavily around evidence-based medicine. So that's really what we need to look at around that, to find a space where you can be comfortable to be able to start to process and grow. And if we look at some of the differences then between coaching and mentoring, we can see that coaching is a structured short-term relationship to get a specific set of objectives. So you go and see a coach, a health coach, a fitness coach, and you say, I've got a race, I've got to run, I want to do this or that. You go and look at a health coach and you say, I've got these challenges in my life in terms of diet, in terms of my headspace, and you work out a set of objectives, and then you work through those, and then the coach steps back and allows you to continue to go on with that journey. Mentoring is a slightly different space where mentoring can be a lifelong process where you're working with a mentee, because it becomes a two-way dynamic where you then move into that space and develop each other at the end of the day. So, and just once again, reflecting back to something I've said in the past, burnout is a message to us. It's not a flaw, and it's not a badge we should wear with pride and say, I'm burnt out, I'm stressed, but wear it with pride. We're not machines. We all deserve better. And we see you. You're not invisible, even when you think you are and you're burnt out. But we need to start changing the narrative. Even in a toxic environment, we need to choose to rewrite the story. You have to make yourself the priority. And we can then learn to help others by not breaking ourselves. So that happens when we start to change the narrative, when you look at your life and you change the narrative and you realize that being burnt out isn't something to be proud of. Because you don't have to be burnt out. You can choose that reflective moment, that between the stimulus and the response, you can choose to not see burnout as a badge that you wear with pride, but something that you actually need to see that you can be better than just being a burnt out medic. You can be a passionate, caring medic without breaking yourself. Make yourself the priority. Make yourself the patient. Look at yourself as the patient. So in closing, just a couple of closing comments. We should all focus on supporting resilience at all life stages. Focus on prevention instead of reaction. Most of us work in emergency medicine. We work in a reactive space. But we need to now looking at ourselves working in a preventative space. We need to have a greater sense of awareness on what can influence or impact our resilience, to either diminish it or to improve it. We need to learn to be sensitive to the environment around us. And most importantly, how we can assist others who are battling to stay grounded, because we're not in this journey alone. We need to look after ourselves. We need to look after the person standing next to you. And remember, at all times, be prepared to hold space with our friends, family, colleagues, staff, and our bosses. So that's the message I'd like to leave with you today. And then, as I said, in closeout, there's a list of all the books that I've worked through in this journey and in the journey leading up to starting this process. And there's wax of different journals, websites, and clinical papers I regularly plow through in the mental health space. And the mental health space there's a lot of work being done in research in medicine at the moment in various countries where they're doing that. So, and I hear what you're saying, Christelle, and that dynamic is true, but we can care for each other, and we can care for the people around us. We can care for the person at our shoulder. So that's important, that we have this space to be able to care for each other. And then around that, we're going to move into a Q&A phase now as well. So Caleb's asked me to handle that, and then I'll also put up the word of the day as well. So, but it's important that we spend some time just focusing on what you've said, Christelle, because I think it's very. I'm also happy to. I mean, there's my contact details are on the screen. I'm happy to chat with anybody who wants to chat as well, offline. I'm quite comfortable doing that. I'm not affiliated with any corporate entities. So let's move into a Q&A space now, discussion. I'll post the word of the day shortly. Armand, stand by. Let's stop sharing my screen. And I'm sure this presentation will be loaded onto the Epic YouTube site as well.
Hi, I think it's more of a comment than a question, but I'm really glad that this topic is being done, because I think about 2 years ago, I did a lot of self-reflection and a lot of work on myself, and started realizing what holding space for myself and taking care of my space and what holding space for others actually meant. And I've seen that come through in my career in an absolutely amazing way. I've seen progression in others that have struggled with this just by being around the fact that I can hold space. And for patients, you know, when we see patients, they're often facing the worst time in their lives. And if we can hold space for that, it just brings the peace in chaos anyway. So this is a really cool topic, and thank you for bringing this to everybody. I genuinely think this is what our service needs, and if we can be more present, we can make such great impacts on our patients and on our colleagues' lives. So yeah, thanks for the super cool topic.
Thank you for that. Much appreciated, Anne-Marie. And then I would encourage everybody who's on the call to log onto the Epic site and go back and listen to the other presentation if you missed the previous presentation, which was like a lead into this presentation as well. So, and we need to focus on how we can look after each other. So, but Amanda, the last sessions, they're on the Epic YouTube site. You can go and view them and listen to them on there. As will this one be for you, with the whole bibliography, etc., for you to go and look at it later as well. So they are available for you to go and listen to down the line as well. And I would encourage people to reach out to people around them. There are many like-minded people like us in EMS. We obviously don't get the chance to speak out as much as we should. And in years gone by, we were not encouraged to speak out at all. But we have a safe space here, and we need to create safe spaces in all areas of where we are. So it's my vision and my dream to take this beyond this and move into safe spaces wherever we need them. And I'll be looking for people to help, like-minded,